Thank you, Mr. Chairman and the sages. This is a list of my disclosure. As you know, the chronic stent is one of the options for the malignant colorectal obstruction. We introduced a chronic stent from 1993, but that time the chronic stent is not covered by national health insurance. Only the 2012, the procedure and the stent was covered by national health insurance in Japan. Now we have two kinds of chronic stent in Japan so far. The purpose of this study is the aim of the study is the evaluation of the short-term outcome of a chronic stent of the BTS for the malignant colorectal obstruction, and this is one single clinical study. The period of the study is from 1993 to last year, and we used several types of stent of uncovered, including esophageal stent. And all the stent was placed with a guide wire under the radiographic and colonoscopic guidance. This is the exclusion criteria of the study, and we introduced the stent only for the very severe obstruction. So we evaluate the obstruction symptom with a cross. Cross is a colorectal obstruction scoring system. When the patient requiring the continuous decompression with a stent or some tube, it's scored 0. And if patient can eat and drink without any symptom of the stricture, cross 4. Technical success rate definition is accurate stent placement with adequate stricture coverage on first attempt without any complication. And clinical success definition is the decompression and release obstructive symptom until surgery without any complication. A follow-up period is until discharge after surgery. We have an experience of over 200 chronic stent in the period, of 8 for the benign and 60 for the palliation, and 149 for the BTS. In the BTS, a mean age of the patient is 67 years old, and 90 was male. This is a region of the obstruction and some success rate. Around the SD junction, the success rate is a little bit lower, and the total technical success rate is 93%. This is the early complication of the stent. We have a 4 perforation, 4 migration, and 5% of complication. And the 5 patients, we had emergency operation, but no mortality with stenting. Preoperative stent placement 3 to 27 days and median 8 days. Clinical success after stenting was 99%. 2 cases we failed to decompression. All the patient was cross 0 before stenting, and after the stenting, it's rising up to the 4, except 2 cases. Clinical success was 92%, and failure is in 12 cases. 10 cases had a technical failure, including inability to pass a guide wire, 4 cases, and perforation is 4 cases, migration 1, and 1 is a poor visualization. 2 cases, we failed to release obstruction after stenting. This is a post-operative complication and mortality. When a patient had a clinical success, 8% of post-operative complication was found, including leakage, abscess, wound infection, and small bowel obstruction. But when the failed, the complication rate was 33%, and we lost one patient with pneumonia. Stoma creation rate is 66.5% in the clinical success cases, but it's 70% in failure cases. This is our data of the study compared with the data from RCT from the literature. Success rate is a little higher and perforation rate a little bit lower, and also the stoma rate and the complication rate is lower. From the 2012, we started a chronic stent safe procedure research group in Japan with over 50 institutions. And also we started one of the largest prospective multi-center study with 513 cases. The clinical and technical success rate was 96% and 98%, and perforation is 2%. Also, we report a follow-up report of BTS with over 300 cases. We report this data last ages. Also, the good clinical result was shown. This is our conclusion. I know the European clinical guideline of the chronic stent not to recommend a BTS for the left side of chronic obstruction because of the poor prognosis after stenting. But maybe the cause of the poor prognosis is perforation. When we can keep the good clinical success with low perforation rate, chronic stent is still one of the standard procedure for the malignant colorectal obstruction. Thank you.